Hello, this is Brandon, your SPTA from FSCJ, coming with you to you with information on stroke rehab. My article was based on stroke rehab and impaired-based approaches and functional goals. So starting off, we all know that a CVA is commonly called a stroke. Happens when blood flow to the part of the brain is disrupted, causing problems with brain function. And stroke is one of the leading causes of death and disability. There are two main types of strokes. We have ischemic stroke and hemorrhagic stroke, which is the ischemic stroke is the most common with about 80% occurrence. It happens when a blood vessel in the brain becomes blocked by a clot, cutting off blood supply. The second is hemorrhagic stroke, which accounts for about 15 to 20% occurrence when a blood vessel in the brain bursts, causing bleeding in or around the brain. And it's linked to things like high blood pressure, aneurysms, trauma, or use of blood thinners. This article was basically a broad view of stroke rehabilitation and explains how physical therapy interventions help patients recover function after a stroke across different stages. The stages was the acute phase, which is the first days and weeks. It focuses on bed mobility, position, and early movement. The second phase was subacute, which is weeks to months. The focus for subacute phase is strength, balance, gait, and motor relearning. And then the third phase was chronic, which is months to years and focuses on maintenance, functional independence, and community reintegration, basically getting them back to their normal life. The clinical argument of this article was basically that stroke rehab is more effective when it is task-specific, goal-oriented, stage-dependent, and multidisciplinary, meaning that PTs, OTs, and speech therapy works together. The key concepts discussed in the article were motor recovery stages, sensory deficits, postural control, gait, strength, flexibility, spasticity, and hemianopia, and unilateral neglect. Lord Jesus, that almost killed me. But yeah, in this article, the physical therapy interventions targeted key impairments to improve functioning, which were all of those that I just named. And that overall, these interventions work together to restore movement and improve function and maximize independence, which we know. This article results basically were that early rehabilitation improves outcomes significantly. And with that being said, I know it's like, well, where are the interventions, the results for specific interventions tailored towards different CVA rehab patients? And in my article, the weakness of this article was that it was not systematic. The testing results were very broad, being that the article summarizes interventions but does not deeply critique study or the quality, which in return doesn't give enough information to acknowledge specific interventions tailored to separate functional activities in these patients. There's only study types compared across many different techniques and approaches with no consistent reporting of effect sizes across all interventions. So really this article was super weak on giving detailed information about what actually works with a stroke. The strength of this article was, though, that it covered almost all the major parts of PT interventions, with the focuses being motor recovery, sensory rehab, gait training, balance, spasticity, and that it was organized by recovery stages, acute, subacute, and chronic, and that it used randomized controlled trials, systematic reviews, and meta-analysis. The bias for this article was that most likely the studies chosen were based on inclusion and not criteria and weren't fully systematic. They were also most likely positive results posted more than negative results, and that there was too many wide differences and patients participating with it doesn't specify severity, intervention, dosage, or amount of the intervention, time with the patient, and then it doesn't really specify the time of the stroke for the patients. So in this article, there was a lot of limiting information on what actually works with stroke patients. Overall, the validity still is moderate to high for the educational and overview purpose of the actual information that was researched, but it doesn't follow strict evidence of a grading review for the procedure or the system that they chose for this research. The article contributes to us as PTAs because it reinforces the fact that task-specific early mobilization, repetition, and neuroplasticity is important for stroke patients, and that it is basically a master overview of the concepts that we have talked about in class concerning these type of patients. Although it was a pretty good article, in the future it would probably need more randomized controlled trials and tests for different types of patients, specifically tailored to their impairments and stages, so we can have just information on the exact type of interventions for the exact type of stages and patients. Standardized outcome measures would make this article stronger. And then a better understanding of, like I said, just the overall intensity, frequency, technology used for these tests and trials for patients, and then the individualized treatment strategies. But that's all I have. Hopefully you enjoyed this video. Thank you.